The lesson objectives that I would like to cover are what is CPR, when you should perform it, the 5 basic steps of CPR, and what you should consider not doing when performing it. CPR is an emergency life-saving procedure performed when the heart stops beating. CPR can be used to help people who are having a heart attack or have had a near-drowning experience. People should learn CPR because 475,000 Americans die at home due to cardiac arrest, and 45% of out-of-hospital cardiac arrest victims were saved by bystanders. When you learn CPR, you can help anyone from an elderly adult to a baby when the right techniques are used on the right person. The 3 questions that you should ask yourself before you perform CPR are, is the person unconscious? Is the person unresponsive? And is the person breathing, and do they not have a pulse? The first step of CPR is to check the scene to make sure that it is safe for you to approach the person, and then check the person to see if they are conscious or responsive. You can do this by tapping the person on the shoulder and asking, "Are you okay?" The next step is to call 911. If you are alone, call 911 before you do anything else. If you are with someone, designate the other person to call 911. The third step is to open the airway and check for breathing and a pulse. Tilt the chin up and put your ear near the mouth and position your head so that you are looking at the person's chest. In this position, you are able to hear breathing or see the person's chest rise and fall, indicating if they are breathing or not. You can then check for a pulse, either on the neck, wrist, or foot. Next comes compressions. Place your hands on top of one another in the middle of the chest. Push down 2 inches into the chest with the heel of your hand for 30 compressions. After 30 compressions, tilt the head back, pinch the nose, and slowly give 2 rescue breaths. Some things that you shouldn't do while performing CPR are, don't give rescue breaths to someone that is still showing signs of breathing. This can cause the person to have more difficulty breathing, or you can choke them. Next, don't perform compressions if the person has a pulse. The pulse indicates that there is still blood being pumped through the body by the heart. And don't bend your arms during compressions. Bending your arms can cause the person to move around more than they need to and can cause more injury. Next, I'm going to ask you a couple of questions to see if you understand the information. I'll give you a couple of seconds between the question and the answer so that you have time to answer. First question, when should you perform CPR? A, when a person is coughing, B, when a person is gasping, or C, when a person is not breathing and doesn't have a pulse. And the answer is C, when a person is not breathing and doesn't have a pulse. Question number 2 is, what is the second step of CPR? A, call 911, B, check for breathing, C, check the scene and the person, or D, give rescue breaths. And the answer is A, call 911. Question number 3 is, true or false? In 1 year, 475,000 Americans die from cardiac arrest. It is true.